Hello, I'm Dr. Kanupriya, Consultant Radiologist at Miracles Healthcare, Gurgaon. Today I'll be telling you something about the ultrasound scans during pregnancy. Ultrasound is a non-invasive investigation, meaning that it is safe for the fetus and the mother. It uses sound waves to evaluate the fetus. A normal pregnancy has around 4 to 5 scans during its entire period. The first scan is done at around 6 to 8 weeks of gestation. The purpose of this scan is to localize the pregnancy, that is, a normal pregnancy should be within the uterine cavity, and we look at the heartbeat of the fetus. The normal fetus has a heartbeat ranging between 120 to 180. The second scan is the level 1 scan or the nuchal scan. It is done between 11 to 13 weeks of gestation, 12 weeks being the optimal time. The purpose of this scan is to evaluate the early structure of the fetus, like the brain, the spine, the limbs. Of utmost importance is the evaluation of the nasal bone and the nuchal thickness in this scan. Apart from that, we look at the ductus venosus, the tricuspid valve of the fetal cardia, and certain blood flows. The third scan is done at around 20 weeks of gestation. This is the most important scan of the pregnancy because by now the fetus is quite well developed. And we are looking at the anatomical structure of the entire fetus. If the obstetrician wants, we can do a fetal echo at around 24 weeks of gestation to see the cardia in detail. The fourth scan is done at around 28 weeks of gestation. This is called a growth scan, wherein we are looking at the growth of the baby, as the name suggests, the weeks of the baby and the weight of the baby, so that it helps the obstetrician to manage the pregnancy accordingly. The last scan of the pregnancy is done between 34 to 36 weeks of gestation. This is called a Doppler scan. In addition to the growth of the fetus, we are evaluating certain blood flows which are important for the obstetrician to manage the remaining of